So my name's Amanda, and today I'm going to be showing you how to perform an aided cortical test on an adult patient. And my patient is waiting in the waiting room at the moment because there's a bit of setup I want to show you before we bring them in. When your equipment is installed, it will be calibrated with a fixed point where the patient should be situated for the test. And this is really important that we do place our patient there to ensure that the stimulus that is delivered from the loudspeaker is delivered to the patient at the correct intensity level. Now here we have a microphone on a stand, and this is used to perform a sound field analysis. So it's a check to see when the stimuli are delivered from this loudspeaker, are they still in line with the calibration that was originally performed at install? What we can do in the software is click on the sound field analysis button, and we can press Analyze Sound Field. We will hear the noise come out of the loudspeaker, and we'll let it be present in a quiet environment for about 5 seconds. We press Analyze Sound Field again to stop the stimulus from being delivered, and we can see on the screen that there's a small variation from the calibrated target. If this is of significant concern, we can press Adjust to Target, and it will realign and adjust the sound field delivery of the stimuli to be adjusted to the original calibrated values. So we can then press OK, and we're ready to bring our patient in and perform the test. So now we have our patient in the room with us, we're ready to get started in performing the aided cortical test. Before we perform the test, one of the most important things to do is to check that the hearing aids are working properly. We need to be sure that they are working correctly before we perform the test. So what I've done is take the patient's hearing aids and run them through the hearing instrument test box to ensure that they're functioning correctly. That's already been done, so we're happy to use these. So the next stage in the process is to get our patient ready for the test himself. For this, we need to place some electrodes on the forehead and behind the ears. And so we'll be using some New Prep skin preparation gel just to lightly prepare the skin and then place those 4 electrodes on. So we're going to take a small amount of New Prep gel. We don't need too much, just a tiny little blob, and place it on some gauze. You can also use a cotton wool ball, and we're just going to clean the skin with this. So the 4 places where we're going to have our electrodes are high forehead, low forehead, and behind each ear. So we'll start with the high forehead. Just want to clean off any dead skin cells, any oils, moisturizers, etc. And we want to make sure that we have a gap between the 2 electrode sites. So you don't want to scrub the full forehead. We just want to do the small area where the electrode itself is going to be placed. And we'll just dry off any excess with the other side of the gauze, and then we can move on to do the low forehead. So the high forehead is where our active electrode will be placed. You can also go True CZ, which is on top of the head if somebody's hairline allows, but high forehead is perfectly acceptable. So this is the same electrode montage for ABR, ASSR, and cortical testing. So our ground electrode will go on the low forehead here, again ensuring that there's a small gap between the areas that we have scrubbed. And we'll just dry that off with the other side. And I'll place 2 electrodes there now. For these ones, these are the Ambu electrodes. They're really nice and sticky. They're my preferred ones. You don't want to press too hard, so we'll just place it on there and then press around the white outline. Don't press on the middle of it because that will disperse the conductive gel that's in the middle. So we just press down, and that should ensure that it stays on nicely. Same with the ground. We'll just place that on the low forehead there and gently press on the outer rim to ensure it stays in place. I'm just going to do behind the right ear now on the mastoid there. So same principle, we'll take a bit of New Prep, bit of gauze, and we'll just clean the skin behind there. Don't want to rub too hard. We don't want to cause any uncomfortable red, dry skin. It's really just cleaning off, as I say, any excess dead skin cells or oils or moisturizers. That's our third one done. So we'll place our electrode on that ear. There we go. Again, just ensuring it's nicely in place. And then we have one more to do, which is the reference electrode behind the left ear. There we go. One last electrode on. Fantastic. So now that the electrodes are in place, what is really important to do is check that we've got good impedances. So we need to connect our electrode cables to the electrode pads. So we'll put the vertex up here. The ground is the black in this case. That's the low forehead. We'll put our right one behind the right. And if I can just ask you to turn towards me slightly, that's lovely, thank you. There we go. So now our electrode cables are all connected. What we need to do is press the impedance button on the preamplifier, and we turn the dial until they all go green, which is all under 1 kilo ohm, which is absolutely fantastic. Remembering it's most important to have balanced electrodes, but they're all in the same area there. And then we can press the impedance button and we're back into testing mode and ready to perform our test. So now we've got our patient in the correct position, and this is really important for sound field testing. The stimuli are going to be presented from this loudspeaker here, and we want our patient to be in the spot that was calibrated originally at install. And this should be the same place where you perform the sound field analysis at the beginning of your clinic. So when you perform that, your microphone needs to be in the same place as the patient is now. And you can see we want the loudspeaker and the patient's ears to be on the same level as well. So that's really important when you consider the age of the patient that you're testing. For younger children, it may need to be lower down. For older adults, you may need to lift the loudspeaker up. Always ensuring that the sound field analysis microphone is in the same position as the patient's head would be. So we're looking at about 1.5 meters from patient to loudspeaker. I'm really happy with where our patient is located right now, and now we are ready to perform the test. So now that our patient is prepared and ready for the test, we can turn our attention to the software settings. In the Eclipse, you will find there is a default preset aided cortical protocol. And within this, the parameters have been set in line with a research study that was undertaken by the University of Manchester, which used the same stimulus set that we have available, the Manu IRU stimulus set. So within the software, once we have selected the aided cortical protocol, it's always a good idea to check those parameters to ensure that you're happy with how everything is set. Everything looks good here. We can see the number of stimuli is set to stop at 300. Now that's going to be a lot more sweeps than we need for an aided cortical test, but it's always good to have that headroom so that it doesn't stop automatically before you want it to. We've selected the Manu IRU stimuli speech sound set in the protocol here. So we have a low, a mid, and a high frequency speech-like stimulus within this set, and we can present these at different intensity levels. So I'm happy with all of the settings there. The last thing to check in the software screen is the condition of the ear or the patient in terms of whether they are aided or not. In this drop-down menu, you can see you have the option for unaided, because although this is an aided cortical test, it can be performed without the patient's hearing aids in. So you can use it as a comparison with and without the hearing aids. You can also select aided right, aided left if they've just got one hearing aid in, or aided binaural. My patient today is wearing binaural hearing aids, so I will select aided binaural. What this does is provide a tag attached to the waveform that you record. However, if you do select the incorrect one or don't select the correct one before you start the test, this can be changed afterwards. It is just a label and that can be changed once you've recorded the waveform. So today, based on the fitting of the hearing aid, I'm going to be testing the mid-frequency. So I'm just going to tick Manu Iru medium. That means that we're testing the medium range speech sound. And I'm going to test at a level of 65, which is ticked here. So that's a reasonable, normal conversational speech level. So everything here is now ready to start the test. So all we need to do is press the start button. Once we press that, it will start delivering the stimulus from the loudspeaker. You do also have underneath that button a pause button, which is really useful if your patient becomes unsettled during the test. Unlikely to be an issue with an adult patient such as we have today, but when performing this test with young infants or young children, sometimes we do need to pause and restart when they become a little bit unsettled. So it's good to have that in mind as an option during the test. So I'm ready to press start. The last thing to do before we do that is just give our patients some instructions. So we're ready to start the test. What I want you to do is just stay sitting in this chair, nice and comfortably looking forward. We have a tablet here to play a silent video. So I just want you to watch that. You won't hear the sound from that, but you will hear some sounds coming out of this loudspeaker. You don't need to do anything with them. You don't need to pay any attention. Just sit back and relax, and I'll tell you when we're done, okay? So it's really important to give your patient a task to do during this test. We want to keep them engaged and awake, but we don't want them to become too interested in the stimulus that we're presenting. So something like a silent video or something they can read is ideal. You do want it to be a decent distance away from them, because if they do read or are watching something too close by, then the movement of their eyes can cause some artifacts that get picked up in the waveform. So this setup is ideal, and our patient is ready to start the test. So I'm just going to press start in the software, and then we'll hear the stimuli being presented from the loudspeaker. So at the top of the screen, we can see the response confidence box. When this reaches 95%, we can use that as a stop criteria. So we're very nearly there. I'm just going to let the test run for a bit longer. Fantastic. So that response confidence, the FMPI, this is our objective indicator as to whether there is a response present within the waveform. And we can see that we've reached well over the 95% mark for that. I can see we've got a nice morphology on the screen as well. We have only needed to record 54 sweeps for this. That's very typical for an adult. Again, for an infant, you might need to test for a bit longer, depending on their state and how active they are. But we're very happy to stop the test there. And at this point, we could then move on to test a different intensity level or a different stimulus, a different frequency range, depending on the patient's needs and how their hearing aid fitting is set. So now that our waveform has finished, we've completed the recording, we can go to the Edit tab in the software, and this is where we can mark up our waveform. So we can take the P1 marker and place that. And then N1 is in the trough down at the bottom, and P2 we can mark here. The other thing we can do is, as I say, we can change the label. So if we right-click on the tag, we've got aided binaural ticked and highlighted, and we can see it says AB. we can right-click that and change the tag. So if we wanted to say that it was done unaided and we just hadn't selected that properly in the first place, that can be done. And we can decide whether to label this waveform as a clear response, inconclusive, or no response present, response absent. So in this case, I'm very happy with the morphology. I'm happy with the FMPI value, the response confidence. So I'm going to mark this as clear response. And it's really important to note that that is a decision that you as the clinician need to make. So the software won't tell you or won't make a decision about whether it categorizes as one of those three labels. That is a clinician-led decision. The response confidence doesn't feed directly into that. It's for you to decide based on the morphology, the response confidence, the residual noise, the state of the patient, how you choose to categorize that, if you choose to use those labels. As we can see, the M stands for the mid-frequency, the medium frequency, and 65 is the intensity level. And this is also noted on the far right that it was the Manu-Iru stimulus set. And we can also go to the report tab here, and this will populate based on the waveforms that you have recorded. So here we can see that we've got the Manu-Iru stimulus set, the mid-frequency, 65, aided binaurally. The response detector value is provided, the residual noise is provided. If you wanted to make a comment about, for instance, the patient's state or the conditions, that would populate in here as well. And the response present at the top of that box, that is because I've labeled it as a clear response. So if I haven't labeled it or I've labeled it differently, that will pull through into this report. And with more waveforms recorded, this will populate with further categories based on what you have recorded. So that is an aided cortical test being performed on an adult patient. Obviously, you can perform this test with pediatrics as well, and things are a little different in that case in terms of how we interact with the patient, the tasks that we give them. We need to consider that based on their age. But for an adult patient, as you can see today, it's a very straightforward, simple test for the patient and for the clinician. It doesn't take a long amount of time, and the software is designed to support you through the process.